time ago. I can tell you I was 5 years old in 1965, so I probably didn't know much about health insurance at that time. But since then, and when Brenda and I, my business partner, bought out John Simpson, we've since added a location. We're now in Manson. We have our office in Johnston, which is where I office out of. And then we have another office in Arnold's Park. Anybody head up to Okoboji ever? Ever up by the lake? Yep. So we're up there as well. We're co-located with Walker Insurance, which is a P&C company up there selling property casualty. And so we're right in the office with them, right on 71 as you head up to the lake. So you can catch us pretty much anywhere around Iowa. So this is my business partner, Brenda Eckerd. I just want you to see her as well as myself. And then here's Christy Klein in our Johnston office. And we just hired Tiffany that's helping Christy. So you may talk to somebody named Tiffany, but Christy is our main gal that you'd be working with if you choose to have a meeting with one of our folks. That would be Christy here in Johnston. We've got other folks, though, clearly up in our Fort Dodge office that can be helpful as well. Sometimes we just can use somebody over the phone, or if you have a question, you could end up at our home office in Fort Dodge, which is okay, right? I think we email all the time that we've got some service people that help us out of Fort Dodge as well. Here's our gal up in our Arnold's Park office. This is Allison, and we've just added her daughter joined her, which I just love, the mom-daughter team up there. Her daughter Samantha, or we call her Sam, just joined Allison up there in the Arnold's Park office. And then we also, as I mentioned, the under 65, we call it Obamacare or the ACA, Affordable Care Act. Those are for plans for folks that are not yet Medicare eligible, but yet they're not on an employer group and they need their own insurance. So we have a staff that help also with those plans up in our Fort Dodge office. And then this is what we're going to jump into today. So that's just a little bit about KHI and our company, and hopefully you just get a comfort level with us. And thanks again, Guy, for that introduction, because I love Medicare. And you guys maybe go, you're nuts. But I think what I love about it so much is that I used to be a school teacher years and years ago, and my joy is helping to educate people and help them understand what their options are. And so to do that, before you can know what your options are, you have to understand Medicare. So we are going to hit all these topics here about, who's eligible for it and what are the parts of Medicare, how do I enroll, what if I want to continue working, and how much of my Medicare will original Medicare cover, and of course, at the end, what are my options to fill the gaps that Medicare doesn't cover. I don't know if you're aware of this, but Medicare Parts A and B, they came into being in 1965. They said Harry Truman was the first enrollee in Medicare, which is kind of cool because he would have been 65 years old in 1965. And so it's kind of cool. So understanding the parts of Medicare is what's going to be helpful here. It's been around a long time, but where we'll really get into is then, okay, so we've got Medicare, we've had it for a long time. What you learn is they don't cover everything. And so then we get to what the options are to help pick up some of the costs that are not covered. So let me go ahead and jump in here. So who's eligible for Medicare, right? And so really it is, you have to be a permanent resident of the United States, and you have to have that for at least 5 years. You, of course, have to be age 65 or older, but there are some situations where somebody's out on disability. So when you get hooked up with Social Security disability, usually within 24 months, you become Medicare eligible. And that makes sense because if you're on disability, a lot of times you're not able to work, which means I need health insurance, right? And generally, again, those folks are under the age of 65. There are a couple conditions like ALS or end-stage renal disease, and those folks usually like that get Medicare. So you might hear of some people, and if you know of people in your family, but we help all these people. This is how you get your Medicare. And when I mentioned Medicare Part A and B, when they developed Medicare back in the day, they said, we're going to make two parts to it. We're going to call one Part A, and Part A is going to cover things like when you have to go into the hospital, if you have to go into hospice, if you need blood, if you need to go to skilled nursing. For some reason, the government thought those kinds of things, we're going to categorize those over here, and we're going to file the claims through what we call Medicare Part A. Then they created, well, I'll get to that in a second because you'll see Part B down here as well. And I will say this, that Part A is free. I put free in quotes. It's really not free because you all paid for it when you were working. And if you're still working, you're still paying a Medicare tax. It's coming out of your payroll check, and it's going to the government to help keep Medicare going, right? So if you've worked at least 40 quarters, 10 years into the Medicare, you've paid Medicare taxes that long, you get Medicare Part A for free. It is a zero premium. I will tell you though, for those that never paid in or maybe moved here and now became residents and didn't contribute, that premium for Part A is right around $500 a month. So it's not inexpensive. So I'm thankful that we did pay for it all those years, because I'll look forward to having that for free as well when I get there. I think you'll notice too that there is a penalty. They talk about if you have to buy A if you don't get it when you're first eligible, and we'll talk about really what that means once we get to the part about I might still want to work past the age of 65. So we'll get to that in a little bit. All right. So the other type of Medicare, the part I should say, is Medicare Part B. Medicare Part B is going to cover things like doctor office visits, outpatient surgery, durable medical equipment like walkers or wheelchairs or things like that. It's most of the things, physical therapy, any of those kinds of things that weren't basically part of the hospitalization and things I mentioned for Part A. So almost everything else. I have people that are going through chemotherapy. They go into the doctor's office to get drugs. Those drugs and that chemotherapy go through Part B. When anything happens in a doctor's office, again, specialist, primary care doc, all of that is going through Part B. And why is that important? They said, well, Part B, we're going to have some cost share. You'll notice that not only is there a premium for Part B you get to pay, okay, this year in 2023, it's $164.90. You can see that on the slide there. And if you're drawing Social Security, it will automatically come out of your Social Security check. If you're not drawing Social Security yet, and you thought, nope, I'm going to wait till full retirement age. I think mine is 67. So, or maybe I wait longer, I'm still working, and I'm not drawing Social Security, then I'm going to have to set up with the government a payment plan if I want to take my Part A and B, even if I'm still working, but maybe I'm not drawing Social Security, right? Then I can set that up and make that payment. And I always tell people, set it up, because if you don't set something up monthly, they'll bill you quarterly. And that's kind of a big bill to get once a quarter. I don't know about you, but I think about folks I talk to, and that when you retire, you're on your fixed income. Like cash flow is kind of like king, right? Like I want to manage my cash flow. So just know that about the Part B plans. I think the other thing I want to mention here is Part B is the one that a lot of people will say, well, I'll just take A, it's free, and I'll just waive my Part B while I'm still working. And you can certainly do that, but that's what we can help you with that. Because I think depending on your situation, your spouse's situation, what kind of plan you're currently on makes a difference. So that's where you want to really sit down one-on-one and kind of learn a little bit more about what's your timing on when you want to get Medicare going, because it's different for a lot of folks. I just met with another gal. I knew her from Ames. I went to Iowa State, and I'm getting that old. I'm 63. I'll be 64 in January. So all my friends are starting to turn 65, and it's like, so they had questions, and she knows she's already retired school teacher, and she's only 64, but she'll be 65 in January. So we're signing her up. In fact, she's already drawing Social Security. She automatically got her Medicare card. So if you draw Social Security prior to your 65th birthday, they'll sign you up for A and B automatically, and then you'll just get your card in the mail. So that should happen. I don't know if that's happened for some of you here yet, but and that wasn't always true. You had to call up and get it, but now you're getting it, at least if you take your Social Security. So I really want to tell you about IRMA, and this is really about managing, and I'm so thankful for Compass Financial because they know this and can work with you. We jokingly call IRMA, she's not our friend. IRMA is the income-related monthly adjustment amount, and if you've made more money, you get to pay more for your Part B premium. So we just mentioned it was $164.90. But if you earn more than, and you'll see here, I'll just kind of point to it on here. Notice the numbers, and see if I got my little red light. Here we go. If you file your tax return individually, if you make $97,000 or less a year, then you're good to go. You will pay the standard $164.90. However, if you file jointly, let's do this one, just multiply it times 2. That would be $194,000 for 2 of you. Here's the problem, you guys. A lot of you you're at your highest earning wages as you get close to retire. Maybe you own a business like me and you're going to sell your business, or you're going to get an influx in income, or you're selling a home and you're downsizing and you're going to have an influx of income. keep an eye on that, not only with your advisor in terms of how much you might be drawing out of your investments, but also your tax preparer, I like to say, because are you taking, and you guys know this about required minimum distributions, you know about your adjusted gross income. That's what they use, is your adjusted gross income to determine this. And it's unfortunate, and I will just tell you, this is my mom. She's 88. Dad passed. He did a really nice job. They're over in Cedar Rapids. And I'm telling you guys, with Mom's Social Security and her RMD, she was at $98,000. So guess what? She got to pay $230.80 for her Part B all year long. And bonehead on me, I should, and my brother, I'll give him a little share of this because he's kind of managing the financial part and I help her with health insurance. But you know what she should have done is taken part of that RMD and given it to charity. And that way she wouldn't have owed more money for her Part B premium, right? Does that make sense? Yeah. So anyway, these are just some little things, but know this as you prepare and get ready to retire and take your Part A and B, you might want to start working your income down if you're together over 194,000, right? So anyway, just keep an eye on that, but IRMA is really important and we'll give more information if we need to the Compass Financial staff to make sure you guys have this. And it does get updated every year. It gets indexed by the government. So it's 97,000. It could be 97,500 next year, right? So that sometimes will change. Okay. And then let's see. I kind of mentioned this already, that if you're already drawing Social Security, you're going to automatically get your card. But if you're not, you really need to get with us. We can help you. You don't need our help. You can walk down to the Social Security office. Now, since COVID's over, you can walk down and actually, I think you take a ticket and sit down and wait for somebody and talk to them. You can call them. You might wait on hold for a little bit, but I like doing it online, so I can be helpful and we do it and help you do it online if you want that too. So either way, and that's the red, white, and blue Medicare card. I think you saw it right back here. There it is. So you know that it'll come with your effective dates. It gives you a funky Medicare ID number. It used to be your Social Security number, and then they got smart and said, why are we publishing their Social Security number on their Medicare card? And I do want to mention this, that just so you know, like my birthday is January 16th. So when I go on Medicare, I will get a January 1 effective date. They always back it up to the first of the month of your birth. So just know that when you're coordinating coverage, if you're coming off of a group plan or you're coming off of an individual plan, know that your effective date for Medicare will be the first of the month of your birth. If your birthday is the first of the month, it'll take it back another month. So if I were born January 1, I would get for Medicare a December 1 effective date. For turning 65, and I'll get it a month sooner, but that's how they do it. Okay, so when do I enroll in original Medicare? So you can have a little window of time here. You'll notice that in the month of your birth, you can actually sign up 3 months before that, and I do recommend that so you get all your ducks in order, right? Get all your ID cards, there's just no issues. But believe it or not, you can wait and do it 3 months after. I've got a school teacher that says, Lynn, I'm turning 65 in April, but my contract with my school system runs me through July. So I need an August 1st effective date. And as I'm doing the math, April, May, June, July, we can sign her up in July and get her an August 1 effective date. No problem. You know what I mean? So we're just coordinating her coverage, and then we will sign her up a little bit later, right? To get her B, because she doesn't need it yet. She's on employer group coverage. So there is what we call a general enrollment period, and that's for folks that missed their opportunity. And let's hope that doesn't happen. That's why we're talking to you now. So we want to get to you ahead of time. And then this is a great question. What if I keep working past 65? And I just got an email yesterday from somebody asking me this. I'm going to be turning 65. Do I have to take Medicare? No. If you're not drawing Social Security, you guys, they're not signing you up for Medicare. So assuming you're still working, you're not drawing Social Security yet, right? You're still working, right? I mean, it would make sense. And so when you decide to stop working, it could be age 66, 67, 68. It could be 65 in 3 months, like my friend. That's okay. The cool thing is as long as you're actively working and you're probably getting your health insurance through your employer, right? That gives you a special enrollment period once you're ready to be done working. Then you go, all right, Lynn, I'm ready to be done, but it'll be January and 3 years from now. And so I'll be 68. No problem. We can take care of you. Let's just meet again a few months ahead of time to get it all squared away, to get your Part A and B ordered so you can get your card, etc. Does that make sense? Okay. All right. And let's see. was going to see if it, yeah, the thing I want to comment here, just really quick on credible coverage, I would ask this, that when you are past the age of 65, we want to make sure that your employer is providing you creditable coverage. So once you or your spouse hit 65 inside of an employer group, they have to, by law, send you a notice that says the plan you're on is considered credible or non-credible. And that makes a difference for the government. So just, yes, if you get the letter that says your plan is not credible, right, and you sign up for part A or B, I mean, then we need to do something else and get you another, there's more we need to do. So I'll just leave it at that. There's some wonky situations you can get into and questions that come up based on where you're at today. And then it's always good that we have a spouse sometimes we're dealing with. So we've got several moving parts here. Okay. So there's the special enrollment period I really talked about. I got to tell you about one of these. So this lady gets her A and B, or excuse me, gets her A. She's eligible and she's supposed to sign up for her B. And we said we want to waive it. She's still actively working. And then lo and behold, her husband gets laid off because she was on his policy. And they didn't tell me. And then the minute that his coverage stopped when he was laid off, it happened to be in February, the 8-month clock starts. You got 8 months till you better sign up for B or you're toast. And which means you have to wait to the general enrollment period. You can't get it when you want it. And it's just, we had to go all the way to Senator Ernst's office to get an exception made. But this is what we do for you. So if there's somebody that comes to me in a panic and said, help, I forgot, I didn't know I should tell you I'm not actively working anymore. We don't have insurance. I mean, oh my goodness, you know. So that's the 8-month thing. You've got, oh my gosh, once that employment ends and that health insurance, you've got 8 months. The clock is starting for us to get you signed up for Medicare A and B. Okay. So, okay. And yeah, I think this is kind of redundant, but it is saying, like, check it out. This is what a lot of people do. Let's say my spouse is 65, but I'm only 62. My spouse wants to retire and I'm on his plan. Well, okay, what am I going to do, right? So you need to consider that. Many spouses say, well, is my plan COBRA? Do I get COBRA from my employer? Now, COBRA is 18 months of coverage. And that would start, right, if my spouse decided to retire, I could take COBRA from the group if I was on that plan, but I only get 18 months. So I better time it right. So it's kind of interesting. Okay, you, my husband, you can retire, but you got to wait. Give me 18 months until I'm 65, right? Just time it right. But we help you with that. But just some thinking about who's working, whose health insurance are we on, et cetera. If the company is fewer than 20 employees, and a lot of people don't know this, it's Iowa continuation of coverage, and it's only 9 months. And so when you're doing the math on that, that's why we help you and go, okay, where are you getting your health insurance? Who's the employer? How many employees do they have? So we can help you guys do the math on this so we time it just right for you, okay? As I mentioned earlier, we do have ACA or Obamacare coverage. That's for the folks that are under 65. And a lot of people didn't even realize that. And they're like, well, I've had cancer. I go, it doesn't matter. It's guaranteed issue health insurance for anybody under the age of 65, okay? Again, leaving group coverage gives you a special enrollment period to sign up anytime during the year for that. So the spouse can look at other options besides COBRA. Okay. So what does original Medicare cover? We kind of talked about inpatient hospital. There's a lot of numbers on the screen. And here's what I want to say, that they do have a deductible. And so there's a deductible, I think it was back on one of the pages, right around $1,600. And then, oh, okay, if you're in the first, there it is, there's the $1,600 deductible right there. And it'll cover the first 60 days in the hospital for that deductible. It's like, yada, yada. It goes down. You can see what it is. And I tell people, I know this is kind of getting in the weeds on Medicare, but what I'm pointing out to you here is it doesn't cover everything. So I call this, if all you had was Medicare A and B, and you can do that, but I say you're leaving yourself exposed, right? Kind of you're naked. I call it you're naked. And I don't recommend being naked and just having Medicare A and B. So I recommend putting something over that, right? And so that's why we're going to talk about the options. But I just want you to see that there's gaps in coverage if you just have Medicare and nothing else. Skilled nursing, the first 20 days. But after that, days 21 to 100 could be up to $200 a day. And you guys, on just Medicare alone, there's no caps. Like, you could keep paying until the end of the year, then you start all over again the next year. So this is why I just want to point out, you really want to have coverage. Again, blood, it covers blood, and the first 3 pints are not covered. But then if you need more than that, like, who thought of this? 3 pints of blood? You get 3 pints, but if you need that 4th one, you're going to pay for it. Okay. Hospice, not to be confused, you guys, with long-term care, short-term care, right? Nursing home type. Skilled care centers, right? A lot of them are inside of nursing homes. Some are standalone, some are inside senior communities on that continuum of care, which is a beautiful thing. But just know that there is some hospice care, but here's the key. And my mother-in-law and father-in-law went through this. Hospice does not cover room and board. And what I mean by that is if you're just going to go somewhere to die, right? You're going to pay room and board. Medicare won't cover that. Medicare will cover drugs, respite care, right? There's some certain things they'll cover. I'm not kidding. A musician came to sing to my father-in-law, right, as he was dying, right? It's a beautiful thing. That's covered. Things like that, right? But they're not covering room and board. So dad and my father-in-law and mother-in-law both decided to die at home. So we brought them home. They'll cover the bed. They'll cover all kinds of equipment that you need at home. So what I'm just saying is hospice does not cover room and board. So I just want to make that really clear, okay? That is a misnomer, and people get really upset. I think years ago, I think Medicare did cover it because people go, when my grandma was in that, I think they did, but they realized then people were using hospice as a place to go die, and sometimes they didn't die for 6 months, right? And so they'd be sitting there, and Medicare's paying. So anyway, a few changes along the way here. Here's the Part B stuff. Part B does have an annual $226 deductible. That's it, once for the year. What are the Part B things? Yep, go to see your doctor, have outpatient surgery, those types of things, physical therapy, chiropractor, all of those kind of visits. You'd pay the first $226. After that, Medicare picks up everything until on your deductible, they pick up 80/20, meaning, okay, let's say I go to the doctor, I'm going to use round numbers, it's $100. Well, okay, let's say I've already met my deductible. My first bill was $226. Okay, met my deductible. My next visit to the hospital, to the doctor is $100. Medicare would pay $80. I'd be on the hook for $20. I go in for an outpatient surgery, it's $10,000. Medicare would pay $8,000. I'm on the hook for $2,000. You see, this is where there's gaps. This leaves you naked. There's some holes in this. And again, there's no cap. Okay, so all right, so you're at risk. So that's why we say we're really going to help you. We want to get you covered. The other thing original Medicare doesn't cover are drug benefits, dental benefits, vision benefits, hearing benefits, exercise benefits. They don't cover any of that. That's not part of original Medicare. Okay, so what choices do we have to fill the gaps? So this is where we get to the real meat of it, right? So hopefully I set just a good foundation for Medicare. So this one now, when you think about option number 1 and option number 2. So I kind of talk about, we're going to go down one path or the other. So the first path that we talk about is we would get a Medicare supplement plan. Maybe some of you have heard of that. It fills the gaps, also called a Medigap plan. It fills the gaps that Medicare doesn't cover. And then you need to buy, and there's a penalty if you don't get it, you need to buy a prescription drug plan. And we call that a standalone prescription drug plan. The government said, we're offering these now. I was at Wellmark at the time when we started training on this, and then rolled it out to clients 2006, January 1. So the drug benefit has been around a while. And the government said, you don't have to buy it, but if you don't buy it now, and then you have an incident, and now you're on some drugs, and you need to buy it, you're going to pay a penalty for every month you should have had it, you didn't have it. So I tell my folks, look, the drug plans are not that expensive. Get a drug plan. Even if you're not on any medication today, you might be. It's just a good investment. So just know that. So it's the Medicare supplement and a prescription drug plan together then with Medicare. You'll notice here's your Medicare card plus your supplemental card and your prescription drug card, and now you're fully covered. Okay, so that's one option. I want to also explain to you about Medicare supplements and the enrollment. So there's certain time frames to enroll in a supplement plan. You can't just wait whenever, willy-nilly. It's like, nope, we're going to align all this when you get your A and B. So obviously we want to have everything start at the same time. So we'll help you with that. They do say, again, if you're outside of open enrollment on these supplements, you could have medical underwriting questions. So this is guaranteed issue when you become first eligible, when you get your A and B. Now you can get any supplement you want, no health questions. In fact, you get preferred pricing with all the companies that are out there. But once you're done with that initial enrollment period, if you ever wanted to switch to a different supplement with a different company or a different plan, you must go through medical underwriting. Now, I will tell you guys, this is a sensitive issue, and I keep an ear to Washington, D.C. and what's happening legislatively, there's rumors about mandating that all Medicare supplement companies need to have guarantee issue policies. Anybody could buy it anytime with no health questions. Yeah, the fear of that, you guys, is what? What will happen to premiums? They would go skyrocket. They will skyrocket. And the sad thing is then you've got all these, then all the bad risk will go into a Medicare supplement because it provides the best coverage. Now, it's not cheap. So I can give you a rough idea, right? I mean, the premiums for supplements are anywhere between, I'll just use round numbers because it male, female, different counties, but 100, 150 bucks. Now you might go, Lynn, that's really good. Goodness sakes, today for my employer group plan, I'm paying $500. Like, yeah, I know. And some of you go, that's terrible, Lynn. I'm not paying anything. I talked to my teacher. God bless you. That's great. Good for you. Holy cow. So now she's going to go, what? I have to pay $150 a month? You know, you see, it's all your perspective, right? But these are just kind of know that. The drug plans run, you know, I've got one, I think we've got one as low as $5 maybe, and they go up to $100. So at least throw an average plan in there for $20. So again, you're in that 100 to 150, 60, $70 a month range, right? Okay. So just know that there's premiums associated with the Medicare supplement, okay? And again, the open enrollment periods, et cetera. And then they, as I said, they don't cover everything. You don't need referrals. And the other key thing, you guys, about a supplement is if your doctor takes Medicare, you're good to go. There's no network per se that you have to care about. You know, if you're on a current plan with your employer, sometimes you have to care, is my doctor in the network? I have to call the 800 number on my card and go, is this doctor in the network? Because sometimes you can go in or out of network and you pay different amounts. With Medicare supplements, and that's one of the big advantages, there's no true network. It's, again, if that doctor accepts Medicare, they'll take you. If they will take a Medicare client, they'll take you. And a lot of doctors take Medicare. There's a lot of money. We get sick, don't we, as we get older? So doctors do well on folks like us. And then I think the other thing is the whether the when Medicare makes the determination, here's what I want to say about this. Medicare has rules about what's covered and what's not covered. If Medicare covers it, your supplement covers it, period. If Medicare doesn't cover it, your supplement doesn't cover it. So I will tell you, guarantee you this, when the doctor comes to you and says, you know, honey, you need to have XYZ procedure, generally speaking, if you say, is that Medicare approved? And they're going to say, darn right it is, because guess what? They probably won't get paid because they're going to come to you for payment. Because if Medicare doesn't cover it, they're going to come to you for the bill, right? And they want to get paid. They want to get reimbursed, we call it, right? So as long as it's a Medicare approved procedure, something wonky, and I used to use the example acupuncture, but guess what? Acupuncture is now Medicare approved. Like, what? Okay, great. I mean, there's some limits on it and where you can go, but so that's not a good example anymore, right? But you get the idea, right? You just want to make sure whatever procedure you're going to have is Medicare approved, and if it is, your supplement covers it. It goes to Medicare first. Medicare pays. What they don't pay, your supplement picks up. It's a beautiful thing, okay? All right. So let's see. Part B deductibles, the coinsurance. This is just showing you all the stuff that Medicare doesn't pay. Your supplement picks up the costs, okay? It's just it's a peace of mind. I call these supplements the peace of mind plan. I pay a premium for it, yeah, whether I use the benefits or not. Yep, I could be paying $150 a month, but guess what? I don't worry about it. Whatever happens, and my spouse. That's the other thing we need to think about sometimes is how capable is my spouse to help keep track of this stuff? If I get sick, can my spouse keep track of this stuff? And you know what? The supplements are easy peasy. That's the gift you give. I've had children buy these for their parents because they know they're the ones that are going to, especially when we get up in age and we need a little help, right? So these are really, I'd call them peace of mind plan. There's different types of plans. They're another letters of the alphabet, and we go over the differences of those. But the best plan you can get today as a new person aging in is Plan G as in George. Plan G as in George. And that Plan G covers everything but the Part B deductible. And I'm going to see if I can point again to it right here. Which, what did I say was the Part B deductible this year? $226. Yeah, $226. But that's it, one time for the year. Otherwise, a Plan G covers everything, anything and everything that Medicare approves, okay? So, and then the prescription drug plans, I kind of mentioned some of this as well too. There's a penalty if you take it. You're eligible, but you don't take it. There's a penalty. And this is, right now, we are, starting October 15th, we are in our annual election period. So once a year, you get to review your plan. your drug plan and make a change. So that's happening between October 15th and December 7th for a 1/1 effective date. So we get really busy this time of year helping people evaluate their drug plan and see, do I need to move to a new one for the following year? So every year you would have a review with us. You get a letter. We send it out usually in about August, September. We say, hey, please update this if you have some changes to your drugs. If you want us to review your plan, we'll do that for you and let you know what plan you might need to switch to. And by the way, this IRMA adjustment, I do want to comment on that. That remember when I told you if you make a lot of money, you get to pay a lot of money. But I only mentioned Part B as in boy. That was that $164.90, like my mom. She got nailed this year, so she's paying $230. Well, guess what? They're going to zing you on your Part D, we call the drug plan, Part D, the prescription drug plans. They're going to zing you on Part D as well. So you get to pay more for your prescription drug plan. I'm like, wait, Lynn, you told me the plans start as low as like $5, maybe to $100, but I like this one that's $5. Yeah, but if you get it now and you didn't have it and you got a penalty, or your IRMA, excuse me, if you're IRMA and you get to pay an extra $10 a month or whatever the number is, right? So just know that they zing you here as well. So we got Part B and Part D that IRMA impacts. Okay. And okay, so let's talk about the second option. So we talked about a Medicare supplement and a standalone prescription drug plan. You tie that up with your Medicare, beautiful. Peace of mind plan, right? Maybe in that $150, let's kind of use that as an estimate, $150 a month. All right. And we come over to option 2. So to set the stage for option 2, these came into being right about that time, about 2006. And I was talking to clients about it, and a lot of people were really skittish. And guess what? Doctors were really skittish about these plans. They were like, what is this? I don't know if I want to participate. Well, you don't have a good provider network. Guess what? You're not signing up, right? I need to know my doctors are in network. Lynn, you just got done telling me with supplements, easy peasy. You take Medicare? Yep, I'll be down, right? I mean, anywhere in the country. You're traveling, you see a doctor, as long as they take Medicare. That's the supplements. Well, Medicare Advantage plans, we call them Part C, just like Part D is the drug plan. They came up with Part C, is what they are calling now this all-in-one plan. They're going to combine health and drug together in one plan, and then guess what they're going to do? The government says, there's an X there, you still have to have your Medicare. That's a little misleading. You still have to have Medicare A and B, but in essence, the government subcontracts you out to a private insurance company. And they go, hey, we've got United Healthcare, Wellmark, Aetna, Humana, Health Partners, Unity Point Health, Mercy One. These are 6 Medicare Advantage plans that are competing in Iowa for business right now. And every year, these plans can change. They file an application with the government approves it, and lo and behold, they're out offering their services for the next year. So these plans can change every year. But what they've done is combine the health benefit and the drug benefit. And you know what the government told them? When you build your plan, because each plan could look different. When you build your plan, it has to be as good or better than Medicare A and B all by itself. So I told you there's some gaps here, right? So the Medicare Advantage plans have to be as good or better than A and B by themselves, okay? So what you'll find is very rich benefits, believe it or not, because you know how much they're getting paid from the government to take care of you? I'll take a guess. Anybody guess per month how much the government is paying an insurance company to take care of you if you sign up for a Medicare Advantage plan? Nope. How much is the government paying the insurance company to take care of you? Has nothing to do with your premium, believe it or not. Well, it does. I'll tell you in a minute. Any guesses? $500 a month. Higher. Right? Okay. Higher. About $1,000 a month. About $1,000 a month. And it's not a bad thing, you guys, because you know what? Not only does the government not have to process the claims, answer health insurance questions, or anything like that, guess what else? They don't carry the risk. So if you have that incident and it costs $100,000, $200,000, $1 million, we've seen claims that go really sky high, that's on the private insurance company. It's not on Medicare at the government level, okay? So think of that as the government said, hey, we want to provide more options. And so it's really a private-public partnership, right? So we've got private insurance companies with our public entity of the government. The government designs the rules, and then private insurance companies raise their hand and go, I'll offer a product. Okay, that's why they get it approved. But and you guys listen, I got to tell you, I do get a little excited about these products, but I don't care what you do. So I'm not here to sway you. It doesn't matter to me. My point is, you've got to get what's right for you, right? I've worked with folks that need a supplement. These products are blowing my mind because they continue to come out with more benefits, richer benefits, and the premium is how much? Zero. The premium for these plans for you is zero. How can that be? And that can be because what? Who are they getting paid by? The government is paying them to take care of you about $1,000 a month, right? To the tune of that. And it can vary a little bit, of course, across the country by state, by county, but roughly $1,000 a month. And so what do they want to do but keep you healthy? They're carrying your risk. If they keep you healthy, do you think they might give you a gym membership if you took one of these plans? Yeah, they do. Wow, isn't that something? Why would they also give you free dental benefits? Because guess what? If you keep your teeth clean and everything stays right in here, that helps the whole rest of your health in your body, right? Same thing with your eye. And sometimes by an eye exam, they can uncover other conditions going on in your body and catch them sooner. See? So I'm getting ahead of myself, but these products are crazy. So it may have a zero premium. You must have A and B, though. You have to buy your Medicare. So that's a done deal, whether it's a supplement and a drug plan or whether it's an Advantage plan. You have to have Medicare A and B. Pay that $164.90. By the way, we haven't heard yet what that's going up to in 2024. This is really weird, but right after COVID, the price of Part B was $174 in 2022, and they go, oops, I think we overestimated. 2023, they brought it down. Never in the history have they ever brought the premium down until 2023. So we'll see what happens with 2024. Maybe it'll go up a little bit, maybe not. When I first started in this business 20 some years ago, that premium for Part B was $90 a month. So you can see how it's gone up a little bit, right? And it will continue to go up. That's just the cost, right, of business. Some of these plans may contain prescription drug coverage, and I will tell you, most of the ones I sell, the reason I would sell somebody a plan without drug coverage in it, if they're a veteran and they have VA benefits, and they're using the VA for their drugs, then that's redundant, and I can get them a better plan without benefits, drug benefits built in. But again, the plans change every year, so we review every year. We just had another seminar yesterday for all our clients saying, okay, here are the changes. Here's what's changing with the plan you have for 2024. Do you want to make a move or do you want to stay where you're at? So this just know that with supplements, here's the other thing. With this Medicare supplement plan, they don't change. The plan is the plan is the plan. What changes? The premium goes up or can go up if the company has a rate increase, okay? And if you turned a year older, yay, happy birthday, then you generally get another little bump because you're a year older and they're age rated, okay? So just know that about Medicare supplements. There's no need to review the drug plan we like to review and the Medicare Advantage plan we like to review. Okay, and yes, this is kind of how it works. Yeah, it's by county. You can see what plans are available in your county, but everything is copay driven. What is a copay? I like to define it as a flat dollar amount that you owe for a service. Coinsurance is a percentage. They're a mixture of some of them have a little bit of copay, which is a flat dollar amount, and some have a coinsurance, which is a percentage of the fee that is charged. Most of them are copays inside of here, but what's cool about it is like primary care office visits for almost every single company that we represent are zero. They're free, right? Free to go see your primary care doc. And not just for preventive. Preventive is always free, right? If it's coded preventive, but you can go see your primary care doc for zero cost on these Advantage plans. The other thing I like about these plans, and you go, how do you compare a Medicare Advantage plan when all of them are zero premium? Because usually we look at price. Well, how much is that? How much is this? They're all zero premium. So now what do we look at next? What is my max out of pocket? So what does that mean? It means how much am I ultimately at risk for in a calendar year if the worst thing happened? If I had a really bad year, what would be the most I could potentially spend out of pocket? That's called your out-of-pocket maximum. And the government sets some maximums there. But then guess what? These plans, they're competing for your business. They want your business. So we've seen the most competitive and aggressive plans that are available for 2024. The out-of-pocket max is around $3,600 or $3,700. Now you might go, oh my gosh, Lynn, that's a lot of money. Well, I've seen some as high as $5,000, and some on the employer group market now, you guys, are $5,000 and $10,000 out of pockets. Those are the maximums, right? So to have an out-of-pocket maximum that's closer to $3,700, $3,600, I've seen them as high as $4,300, $5,000. So you're going to be right in that range. And here's where it's important to get back to your Compass Financial person, because you're going to say to them, hey, I'm not sure if I want to go supplement or Advantage, but do I have liquid money that I can access if I need to for health insurance claims, right? Do I have whatever that max out of pocket is? Let's just round it to 4,000. And it's per person, by the way. So if you have a husband, wife, and you're both on a Medicare Advantage plan, then that's $8,000 potentially. You got to have access to. Let's say you're both in a car. I'm just apologize, but you're both in a car accident, for example, right? You might both meet that 4,000 out of pocket that year, but then hopefully next year you won't. Now, this is kind of a joke, and you might say it's kind of sick, but I tell people when they get kind of nervous about, well, Lynn, what if I just meet my out of pocket max every year? I say, you'll soon be dead. Joke. It's kind of a joke. Maybe not funny, and I wouldn't tell it in another environment, but no, I do say though, if you're going to meet your out of pocket, it's kind of hard to meet it. Actually, you have to be in and out of the hospital, in and out of skilled care, having a lot of physical therapy, because these co-pays. Let me give you an example. I told you that a primary care doc was $0. If you go to a specialist, 15 to 30 bucks. I've seen them right in that range. Again, it depends. That's how you now start to evaluate the different companies. What's important to you? Like, hey, I go to a specialist every month. Then let's look at the specialist copay. How much is it? Let's compare that then, besides the out-of-pocket max, right? And then what about if I have to go into the hospital? This is a big one. Well, if you're going into the hospital, think about this, you guys. You're inpatient in the hospital, and these plans usually spell them out 350 to 400. I'm going to use 400 because it's a nice round number. They'll say $400 a day for the first 5 days. How much is that? Do the math. $2,000, right? Right there is $2,000 toward that potential $4,000 out-of-pocket max. Right there for a stay in the hospital for 5 or more days. Okay. Now, what if you're only in for 1 day? It's only $400. You see, and all those copays go toward that max out-of-pocket. Once you've hit that max for the year, you're done paying, and everything's covered after that. And then it starts over again January 1. And I tell people, try not to get sick on December 31st, because what'll happen is you're going to hit it in that year, and then it's going to roll over, and you're going to have to hit it again this year. So then you can have, you see what I mean? Back-to-back whammies, right? Now, we can't control that, but just know that and be prepared for that, right? But the other thing I tell people about the Medicare Advantage plans, and this is, again, a little bit silly, but I do like to play blackjack. I will admit, I like to gamble. I don't go to Prairie Meadows very often, but we sometimes have meetings there, and then I sneak into the casino. But sometimes I'll ask folks, how many of you like to gamble? Come on, let me ask you guys. Raise your hand if you like to gamble. Okay, couple. Thank you for being honest. Some you guys like to, and you're like, I'm not gonna admit it. Or I just do a little. I go with $20, and that's all I do. Yeah, and that's fine. My analogy a little bit is Medicare Advantage plans are a risk. Medicare Advantage plans are a risk. Why? You're risking that max out of pocket. You're risking that I could have that tough year, right? And for folks with Medicare Advantage plans, when they go so long with not having any claims, and they're like, look at all that money I've saved. That's when I go, remember that. Because if you've saved your premium all those months, hopefully you've saved it up. Again, dealing with your Compass Financial folks, just know what's the best for you. And by the way, one spouse can do Advantage and one spouse can go Medicare Supplement. I tell a lot of people, if you've got chronic conditions and you're doctoring all the time, oh, goodness sakes, I would go with a supplement. Because I know, I've got a friend that has MS, and she just turned 65. So she was on disability, and she finally turned 65. She could have an open enrollment period. When she turned 65, she got her supplement plan. That's exactly what I wanted her to have, because she's going to be in and out of the hospital is what happens. She's just got a lot of doctoring that she does. So supplements are right for the right people. When you want that peace of mind, you don't want to worry. Medicare Advantage, a little bit of chance, right? You take a little chance that hopefully you're not going to get sick, and all kinds of stuff. No underwriting. I think I mentioned that. Here's the additional benefits I was mentioning to you that we've got. Of course, the dental and vision and hearing and the exercise. Literally, you guys, they pay for a gym membership. It's not ridiculous. I get it now. They want to keep you healthy, because if they keep you healthy, they save money. They've only got so much money to work with, and they're competing, so they don't want to start charging you a premium for these plans. Wellmark has a plan that's $49 a month. I think Health Partners has one that's $49 a month. Why would you pay $49 for an Advantage plan? Well, they've sweetened some other benefits in there. So that's why we look at what's important to you to see what plan would be the best for you. Dental benefits could be important or not. My 88-year-old mom, you guys, is on a Medicare Advantage plan. She doesn't go to the doctor. She takes no medications. And by the way, she's just done doctoring it all. She's like, I'm done. Well, let's get you a Medicare Advantage plan then, Mom, because you're not doctoring. You refuse to doctor, and we have a do not resuscitate order. Okay, so maybe Medicare Advantage is just fine for my mom, and it is, right? But again, everybody's different. But these extra benefits are amazing, like I said, and the vision benefits too. They're all, you guys, this is a zero premium plan. I'll give you an example. They give you $1,500 worth of dental benefits. Go get your teeth cleaned. Knock yourself out. Get that root canal. Get that work done. Go get a new pair of glasses. Get those contacts, right? Get your gym membership. It's all Zero. It's all part of the plan for zero premium. It's like almost too good to be true. And I got to tell you one more thing that Aetna just rolled out. I couldn't believe this. We were doing a seminar yesterday. How can they do this? Because they know they want to keep you healthy and they're competing for your business. Did I not say that like about 10 times already? All these 6 companies, again, we don't care what you do. We're going to lay out what it is, and we're getting close. Thank you, Guy. But I'll say this, that Aetna is now offering a $600 fitness reimbursement. Like, say what? This is in addition to all this other stuff. You can have your gym membership, but you can get a new set of golf clubs. Now, I don't know if you can get a set of golf clubs for $600. Maybe you get one club. We were joking. One club maybe. But if you spend it on bowling, fishing, gosh, they had Zumba, they had pickleball, equipment, any courses, classes, anything you need. It's crazy. So it's true. It was perfect timing because we're right at the end. So as you can tell, I hope you see, like, I love this space. I love one-on-one meeting, and I'll stop there.
Absolutely. So first of all, thank you, Lynn. That was a wealth of information. Yeah. We're going to open it up to questions now, and these microphones are for the benefit of the people online so they can hear us. As I was listening to this, I had a few questions for you, maybe some common ones. What about the networks? Talk about the network differences, because you said on well, go ahead.
Yes. So as I mentioned, the Medicare supplement is awesome, right? Hey, do you take Medicare? Yep. Boom. We're in. On the Medicare Advantage side, where I mentioned that, the doctor has to contract with that insurance company, just like they do in the employer group space today. They have contracts with physicians groups. So you need to check if your doctors are in network. So normally when we have a meeting, I want you prepared with what are your prescription drugs that you're taking and who are the doctors you're visiting. And then we do that with you and for you to plug them into we have a cool tool that we use. We plug it in and it will help us see who's in network and who's not to guide us into which plan would be the best for you.
So on the Advantage plans, like the Methodist Advantage plan, you're kind of limited to the Methodist system, right?
Not exactly. And here's why. And I didn't mention the HMO and PPO networks, but if you've ever heard of those networks, an HMO is based in Iowa only, a PPO is national. It actually can go global, but not with Medicare. In your employer group space, the PPO usually is global. But in the Medicare space, it's United States only, but it's all states in the country on a PPO plan. So we have Medicare Advantage plans that are HMO and PPO. So again, we like recommending the PPO plan. There's still zero premium. Because for those that travel. Now, if you tell me you're never going to go, how about Mayo Clinic? Here's another big one, is Mayo Clinic in network. And when people want access to Mayo, I only have 3 options. It's Wellmark, it's United Healthcare, or Humana for Medicare Advantage plans. If you're on a supplement, you're good to go, right? I mean, get your referral and get up to Mayo. They'll take you because they take Medicare. Yep.
Another question that often gets brought up is drug plans. Okay. And what I mean by that is walk us through how important it is to find out which pharmacy you're using and which drugs you're taking.
Yeah, wow, that's amazing. I'm just listening to the rain for those folks online. It's loud. Very good.
You ought to hear it when it hails.
Oh, I bet it when it hails. Yeah. Oh goodness. So you guys, the drug. So I think the question was really around the drugs in terms of coverage for the drugs.
Yeah. So how big of a difference can it make? Either switching pharmacies, being on the right drug plan. I've heard it makes a huge difference.
It makes a huge difference. So here's what I want. We ask for your primary pharmacy that you like to use. It could be Hy-Vee, CVS, Walgreens, Walmart, Costco, Sam's Club. You let us know what Hy-Vee, did I mention that one? What pharmacy do you like to go to? We plug that in, but I also plug in a couple more because in the drug plan specifically, whether it's inside of the Medicare Advantage plan or standalone on the supplement, either one, I want to evaluate that because it does make a difference. If you do mail order, a lot of times your drugs are free. If you go to a preferred pharmacy, your tier 1 and tier 2 generics are free. If you're going to a brand name drug, I want to find you the lowest copay for that brand name drug, and that'll help guide me. So it does matter who the pharmacy is or what pharmacy you want to go to, and that's why we do evaluate those every year.
Good. Last question from me. The new obesity drugs. A lot of press. I don't know if you've all been reading about the new obesity drugs. It's another big revolution in medicine. Is it covered by Medicare?
Yes, and I'm thinking of Ozempic, if that's the one that you're thinking of. And there's such a controversy over that, right? Because they were running out of supplies. People with diabetes couldn't get it because people wanted it for weight loss and all that kind of stuff. So it is covered. Medicare covers it. And I do another thing in our seminars once a year. And as I said, I just did this yesterday. I talk about what the government has done in terms of legislation to change specifically anything in our market for Medicare. But I'll tell you guys, there's changes coming right now in the prescription drug plan programs. So what's happening in 2024, they're eliminating the catastrophic phase of the drug plan. There's 4 phases to it. I won't get into it today, but there's some good things to help you guys lower your costs. But guess what? By 2025, there will be a cap on all prescription drug costs through Medicare at $2,000 a year. There's no cap, you guys, today to how much you could spend out of pocket for your medication. There is no cap today. There will be in 2025. And that was thanks to legislation in the Inflation Reduction Act of 2022. So we'll keep you abreast of that as well.
All right. Open up the questions in the audience. Please speak into this so they can hear you online.
I recently saw a TV ad from Mercy One, Medicare Advantage, and it said if you enroll with them, you get $100 a month back on your Social Security. I called the number and I said, how can this be? Well, he says they're going to reduce the Part B premium. They're going to cover $100 of the Part B premium each month. Now, who knows how long that'll be that way, but that's what he told me. So that increases your Social Security by $100.
So the Part B give back is a lot. Thank you for the question, and hopefully everybody heard it in the room. Did everybody hear the question around the part? I'll call it the Part B give back. Some of the insurance companies, again, to sweeten things, right, to draw you to them, is to offer you then a give back of your what we're calling that Part B premium. So if they're saying $100 a month, right? One of 2 things are happening, because I think Humana is rolling this out as well. But you can get a little short-sighted, and Humana's I think is 84, Medigold now Mercy One is 100. You can get sometimes short-sighted because guess what? You look over here then, what's the max out of pocket? How much are my copays? How do my drugs work through there? We have to look at it, I think, at a higher level versus just zeroing in on that give back. But it teases you, doesn't it? It's kind of it's interesting. How does that work? So we'll look at that with you and for you. And if that plan seems to work out well, the other thing I want to mention is there is, for folks that are low income, they do get some of that payback, right? And then you got to be on low income to be able to get some of those benefits. And they kind of, not that Medigold is misleading or Mercy One, but some of the ones on TV caution you guys, the Joe Namath commercials, the JJ Walker, just be cautious. Oh, call this 800 number. You guys, they're agents just like me. They're just at an 800 number, and they're going to sell you something over the phone or try to sell you, see if you qualify for benefits. Yes.
Along those lines, we have a question from online. Can we sign up for Medicare Advantage on Medicare.gov, or do we have to go through a private insurance provider or broker?
Yep, good question. You can sign yourself up at Medicare.gov all by yourself. You bet you can. What I do want to mention to you is you don't pay any more or less to use an agent. So I encourage people to use an agent. I mean, whether it's us or another company that you find, it's fine. I would say use somebody, because you need that advocate. When you run into trouble, good luck then on the 800 number, trying to get somebody to help you. But when I told you I took this case to Joni Ernst's office, I took the case to Joni Ernst's office and we got it fixed. So I'm just saying there's a value, we believe, of course, this is my livelihood. I believe there's a value in what we do. If you don't see that value, yes, you can buy yourself online.
Well, we absolutely see that value, because I think about all the things that were talked about today and all the changes that happen from year to year. That in itself, having somebody that's on top of those things and giving you advice about what your options are, we think makes a lot of sense. Question.
I'm going to refer to the IRMA. So let's say I'm taking Social Security and my pension, and I'm under that 97,000, but then I turn whatever that age is that I have to start taking my annuities. So when that all adds up to more than 97,000, so does my payment?
Then your payment will go up. Yes,
Okay.
your IRMA, and that's exactly right. And that's why I love my story about my mom and how I kind of screwed up for my mama. That you can take, and that's working with you guys, right? You can take, this is what you take some of that RMD and maybe can give it to charity that will lower that, so that that's not your taxable, then it's your, you guys know that. You guys know that better. So talk to Compass, but yes, you got it.
Another question.
So did you say there's 6 companies or 6 choices for Advantage in Iowa? Is that accurate?
Well, there's more than that, but those are the ones, they're by county. So there's another plan that's over in Dubuque County. There's another plan that's up in the South Dakota, kind of that northwest corner of Iowa. And so we do represent those companies as well, but not here today. So I would say here in the Des Moines metro area, and just broaden it out to all the counties in Des Moines metro, we do have those 6 strong options, yes. And I'll just say them again because it's good for you to know and watch out. Mercy One, because they've rebranded, they were Medigold, now they're Mercy One. And you guys, Mercy One, don't think that you can't go to Iowa Clinic or Health Partners, because they have a PPO plan. They have in and out of network benefits. You might pay a little bit more to go to, like your specialist visit might be $10 if you're in network and $30 if you go to an out of network. So it might be a little different, but that's where we help you decide who are your doctors. So we got the Mercy One. We have Health Partners, Unity Point Health. Again, they're Unity Point Health, not to be confused that they don't allow you to go to Mercy One, because they do. Again, they have a PPO plan, so they can go in and out of network. And Health Partners copays are exactly the same whether you're in or out of network. So that's interesting. Like, oh, so I truly can go anywhere. Yes. And then Blue Cross. I'll finish out really quick. Blue Cross, Aetna, United Healthcare, Humana. So those are the 6.
So that might actually answer this question. So a person can have a primary doctor at Iowa Clinic,
yep,
and have a specialty like a gynecologist at Unity Point.
Absolutely. And
on the Advantage plan.
Yes, but I always make sure it's a PPO. It gives us the broadest network, and then I always love to check and make sure that doctor is in network. Yep.
Good. Anything
Absolutely.
else? We're running right up against time here. Any other questions?
I'm sort of confused about the hospital benefits and Advantage. You were talking about so much per day. Is that the amount you're paying per day? When we're talking about those hospital days, is that your payment?
That is the member's responsibility. The patient's responsibility is that copay. And then I'm going to add on to your question, because this came up yesterday. Does that mean, Lynn, if I have surgery, if I see doctors, I'm on drugs, I'm getting physical therapy, I'm seeing occupational, all of that's covered in that one daily copay. So there's no additional charges when you're in the hospital for anything that could happen while you're in the hospital. Is that one daily copay for how many days you're in, and that's it.
All right, another question?
This is an easy one, I hope. So let's say you sign up for like a Wellmark or Unity Point or whatever, and you move out of state. What happens then?
Great question. So if you move out of state, the government says you must live in the county that plan is offered in. And if you move, and I had somebody, literally, you guys moved from Dallas County to Madison County, we had to make a change to their plan because the plan that they had was not available in Madison County. So that could be across just even in Iowa, but it definitely, when you leave the state, what I like to say is we're in some of these states surrounding Iowa, but if you said, hey, look, I'm moving, I just had a guy tell me this yesterday, I'm moving permanently to Florida. Well, I don't market plans in Florida. And I said, what I can do for you is find you a me in Florida. So that's the best I can do. And then you have to change plans within 60 days of your date of residence then in your new state. Now, can I just add one more thing? With a supplement, you can take it with you. An Advantage plan, you cannot. Drug plan, you cannot. Supplement, you buy it here when you're a resident, you can take it with you wherever you go.
All right, last question. How many people as a percentage do you see signing up for each plan?
Great question. And we just as a country just hit the 50% mark. We have 50% of the people taking Medicare supplements, 50% of the people taking Advantage. It's crazy. That's on all Medicare eligibles. There's close to 70 million Medicare eligibles in the United States. So just cut those in half. Half are on subs, half are on Advantage. And in Iowa, though, we're a little bit behind that. We don't quite embrace some of these trends as quickly as some of the coasts do. So we're probably closer to about a 30% Med Advantage, 70% supplement right now in Iowa. But people are starting to move. It's interesting to see. How can you not at least look at some of this stuff, right? But maybe not. So, yeah.
Lynn, thank you so much. Do you have cards if somebody wants to take a card, your business card?
Absolutely. In fact, I probably would. I've got Christy's card, and then you can just reach directly out to Christy. So she's the one that would set the appointment with you. But I would say this, I've got cards as well. If you just want information or maybe sit down and have more of a one-on-one, you're not quite ready to do Medicare yet, work with me right now because Christy is working on reviewing everybody, all of our current clients, and doing all the annual reviews. So I'm a little more freed up to do some of the I'm just kicking the tires. Call me on that. Yeah.
All right. Appreciate everybody showing up today. Stick around, talk if you have questions. Thank you. We're going to sign off. Thanks for joining us.
Thanks, everybody.
Yeah.
Thank you.